And we're back at 14 minutes after. Lawmakers' top priority is overhauling the healthcare industry. And with an estimated price tag of over $1 trillion, it's no wonder shares of healthcare companies were rising yesterday. Let's take a closer look at who stands to benefit from the president's healthcare proposals. Dr. Robert Glassman is a private equity partner at OrbiMed Advisors. That's the world's largest healthcare dedicated investment firm with approximately $5 billion in assets under management. Dr. Glassman is also a clinical professor of medicine at Weill Cornell Medical College. Dr. Glassman, good to have you with us. Good morning.
Nice to be here, Phil.
Hey, you know, at first blush, when you hear about the president's plan about all Americans, he wants all Americans to get medical insurance, you would think that this would be a plus for the industry, but not so fast, right?
Well, I think the devil's going to be in the details. Let me lay out the problem and why this healthcare reform is viewed as important to him. The cost of medicine has been growing 2.8% per annum over inflation. If it continues like that over the next 30 years, it's 30% of the GDP.
Right.
So there's a problem with cost of medicine to begin with. The second part is that coverage of 15% of Americans, 40 to 50 million people right now, are uninsured.
Right.
Now, about 65% of that is uncompensated and 35% is out of pocket. That amount of money is around $100 billion per year for the uninsured. So if you take that forward, you know, with inflation, that's a lot of money. You have to cover all these costs. You have to finance that. You have to finance the reduction in the cost, you know, as for healthcare as is.
Hence the devil's in the details.
Devil's in the details.
Well, I guess, you know, everybody in the healthcare industry is kind of wondering how this is going to play out for them. I mean, for the first time in a long time, you've got everybody pretty much on board. You've got, you know, doctors, you've got insurers, the drug and device makers. I mean, they all seem to be wanting to make these changes. But how do you think these groups are going to be ultimately affected?
Well, it depends on what happens. I mean, so how do you finance this? One way is to increase taxes. That's the way it's done in many advanced industrial countries. You can do that through a recovery of the tax exclusion on employee benefit insurance, which is about $250 million per year. That is really just another burdensome tax potentially on the middle class. You could also just reduce costs through market-oriented means, either through demand or through supply. And the last part, which is what a public health plan potentially would do, and where the fear is that it would reduce the price. When you reduce the price per unit, all else being considered, it's a problem. You know, what we want to do is reduce fraud and inefficiencies and waste and that sort of stuff.
Right.
And that's not necessarily...
Well, you know, we come at it certainly from a lot of different perspectives, but certainly the business perspective. And in terms of the companies that are impacted, what companies do you think are going to be the most impacted potentially by this proposal?
Well, I mean, clearly the insurance companies are going to be impacted because you're going to have some sort of potential competition between public plans and private plans. Public plans will be viewed as more affordable. They'll have wider pooling of risk. They'll have more capital stability. And the private plans will have more flexibility, better provider network, et cetera. So I don't know how that's going to play out.
Right.
My concern is what happens to life science companies, either medical product or biotechnology companies, where innovation is important, because right now innovation is under severe pressure.
Right. So you're talking about plain R&D.
Plain R&D. Right now, to get a new drug from concept all the way through to approval is around $1.5 billion risk adjusted. It is very difficult to get drugs from the laboratory into humans, and then approved. So
do you think that's the biggest risk in this plan that's being proposed by the president?
I think it's one that has been glossed over a lot, because, you know, industry needs to recoup the cost of their investment. And right now, the very naive way of looking at it is, hey, it costs 8 cents to make the pill, and they're charging $10. There has to be some really egregious things going on here.
I've just got less than a minute left here. So in terms of winners or losers, if we could break it down, and I know a lot of details still have to be worked out. Can you give me just quickly maybe a couple of winners, a couple of losers?
I don't think I can say, until you understand what the price per unit is and how all these things work out, I don't really know. I think a lot of people feel it's a wash right now. I'll say this: in 1965, before Medicare started, everybody thought all the drug companies, all the device companies, doctors, everybody was going to get killed. It was the biggest boom ever in healthcare.
So go figure.
Go figure.
All right. So we've got to wait.
We've got to wait. And one more thing.
What?
Go Braves.
Go Braves. It's for your son's team?
It's my son's Little League team. They're playing for the championship on Saturday.
Got it. All right. Dr. Glassman, good to get some time with you. Thank you.
Thank you very much.
Dr. Robert Glassman, he's private equity partner at OrbiMed Advisors.